Thank you for joining us here today and for tuning in. As you know, this is my first address to the people of Colorado since our nation reached the tragic milestone of 100,000 losses from the COVID epidemic, more than the Korean War, the Vietnam War, Operation Desert Storm combined, and such a short period of time, just really all in the last 3 months. The nation has suffered. My heart goes out, my condolences to the families of all those that have been affected, including over 1,100 deaths in Colorado directly due to COVID, over 1,400 deaths among those who were suffering from COVID here in our state, again, all in the last 3 months. While we reflect on the losses that we've had, there also continues to still be some encouraging data, reason for hope. We don't know. Scientists don't know. Health officials don't know whether the worst is ahead of us or behind us. And frankly, that will largely depend on your behavior, on how well people wear masks in public, how well people avoid large groups and social interactions, stay at home where you can, be outside away from others. Those decisions will really determine whether the worst days are ahead of us or behind us. One thing is certain, though, there is loss ahead of us. 100,000 deaths and counting in our nation over the worst pandemic since the avian flu pandemic of 1918. Today I want to talk a little bit about the need for older Coloradans and those with underlying health conditions to stay at home as much as possible. And we know there are people living among us who have a 10 or 20 times higher risk simply because of their age, simply because they might have a respiratory condition. And it was difficult for all of us to stay at home in April. Thankfully, that stay-at-home order ended April 27th, but it is particularly difficult for those who are looking at another month and hopefully finding ways that they can largely stay at home in June, who are older Coloradans and those with pre-existing conditions. And that's difficult. But I know Coloradans of all ages love life. We cherish life. We want to protect our lives. And that's the decision that so many older Coloradans are making. Today, I'm going to bring in a special guest to help discuss how seniors can weather the storm and stay home. We've all had these discussions in our own families with our aunts, our uncles, our parents, our grandparents. And today I'm honored to welcome my mother, Susan Polis, who's joining us via remote video. Mom?
Hi, honey. Should I take off? Hello.
There you are. You look good, Mom. So look, you and Dad, and by the way, happy 76th birthday. You turned 76 last week.
Pronouncing that.
You and Dad have been home since early March. You haven't left your home. You haven't had guests over. I know that's been hard, but maybe you can share with our friends how you were able to do that, and how you're also planning on doing that in June, just staying at home. And how are you living in that way where you literally haven't left the house?
Well, obviously we don't want to get sick and we don't want to get anybody else sick. So we felt it's very, very important to stay at home. We haven't seen anybody since March 1st. We don't plan on going out probably for another month or two. And so to us, isolating has been very annoying, but it also has its good points. But we don't have the sadness that a lot of other people have in isolating. So we're very fortunate in that. And
I heard that the other day, is it you walk 3 miles around the yard in circles to stay fit? Is that right? I'm very proud of you.
Yeah, that's one of the things we do. We walk around the perimeter of our house like 1 million times, so all throughout the day, so that it adds up to 2 to 3 miles a day.
Well, I'm really, I know that you want to protect, your lives and you're staying home. And I just want to say how glad I am, because in 4 years, we want to have a huge 80th birthday party for you and Dad, and we want you to be healthy. And we also want you to be there when our kids graduate high school and college. And so I know it's hard. Talk about how you've talked to your grandkids on the phone and FaceTime, and how you, in some ways, are even closer to them because you see them all the time that way now.
But not in person. But you know, how you cope with this or compensate um, is to really have a perspective on what's happening. I mean, it's really sad with all the people passing away and the families, and we don't know what's going to happen. It could get worse, it could get better, people losing their jobs, wages. So our isolating is mostly away from our family. Steve and I are very lucky. He's my husband of 51 years. We're very, very lucky that we get along so well and we love each other. So it's really not that hard. But we made up a second best situation. What is it? So every morning, my grandson, your son, FaceTimes us, and he plays a beautiful song on the piano, which wakes us up. I read to our granddaughter, your daughter, every night. We FaceTime the family, we Zoom the family, we Zoom friends. I'm working on a new film called Love Wins Over Hate. And my editor is in Denver, and since I can't go there, we Skype every day, and we work all day on Skype. I text, email, I speak to you on the phone every day. So there's ways you can compensate.
What's been the hardest part, and are there any silver linings to you having not gone out in 2 months and not going out for another month at least?
Truly, the hardest part is being away from my family. That is, it's really hard. Like I know my granddaughter grew 2 inches since I saw her last. I can't even imagine her with 2 inches more. So that's the hardest thing. And as I said, we're very lucky because that's not all that hard. Nothing compared to what many people are doing.
Well, thank you, Mom. And I think speaking on behalf of our kids, they are really happy that you're staying safe, and they want to make sure that you get to be there for when they grow up and go to high school and college and get married. Cora's still saying she wants to have kids at age 20, so we'll see. That's pretty soon, but we're telling her maybe 25 or 30. But she's excited, and they can't wait to see you in person, and we all can't wait to see you in person. But we know that we are all going to see you in person because you're being safe right now. So thank you for staying in since March and continuing to do that through May and June. I know it's not easy. We're staying in touch with you every way we can, and of course we can. We really look forward to seeing you in person again sometime, and I'm so glad that you're safe. Thank you, Mom.
Thank you, honey. I just had one more thing I wanted to say, that another silver lining is how lucky I feel, and the gratitude I have for life and our family and the love that we have. And I'll never again take anything for granted. And continue doing the job you're doing, Jared. You're saving lives.
Yeah, and I think a lot of families, when they can get together, when it's safe, hopefully it's July, it's August, whenever that is, we're all going to appreciate it even more, right? We're all going to appreciate being together even more. So thank you, Mom and Dad, who's also there listening. I know he's working the phone for the camera. Thank you for staying home. Thank you for staying safe. I love you both. We'll talk to you tonight. Thank you.
Bye-bye.
And it's so important. It's important because, of course, our older Coloradans and those with pre-existing conditions want to stay healthy. It's important for families that we want them to be here for many years to come. It's also important systemically. This was one of the main takeaways from Dr. Samet's healthcare model that he put out on, I think it was this past Monday. In the aggregate across everybody, we know that every older Coloradan that gets COVID-19 has a 10, even 20 times greater likelihood of having to go to the hospital. So it fills up those hospital beds quicker when older Coloradans get it. That's worse for them. It means they need intervention, and some of them will make it out of the hospital, some of them won't. But it also means that it really makes it harder for those with non-COVID related conditions, other patients with COVID, to make sure that we have the space to serve them in the hospital. So it's very important as we navigate all of the opening in Colorado, and restaurants are open, stores have been open for about a month, and people are back to work. That the decisions made by our older Coloradans are really who have the most at stake, who are at the greatest risk. And I do hope that folks have that frank conversation, with folks, and just let our parents, our uncles and aunts, our grandparents know how much we love them, how much we look forward to seeing them, and how we want them to be with us for many, many years, and that our behavior over this next month is really going to really affect the risks of how well we can make sure that they stay healthy through this. A few more updates. We know that testing, monitoring, critical components of limiting the spread of coronavirus. And we also announced we've doubled the number of epidemiologists, and we're also working to help counties with the increasing their capacity. And we unveiled our symptom tracker tool, and I want to highlight this for a moment. We built a symptom tracker in partnership with Google and MTX. It's at covid19.colorado.gov. It's in English, y Español, and it's already been used by over 2,000 Coloradans. It provides our state with crucial epidemiological data about what's going on where, who has what symptoms, so that we can better craft targeted responses to this virus. And it's really important if you have any symptoms, cold or flu-like symptoms, please put them in the symptom tracker at covid19.colorado.gov. I'm also glad to announce that the state's Care Facility Task Force has completed 747 infection control surveys, including a survey of 100% every nursing home in the state. They're absolutely critical. We know that nursing homes have been particularly vulnerable to outbreaks. This survey, the steps we're taking to protect our nursing homes, the testing of the asymptomatic folks is so important. We've also received 1,048 isolation plans from congregate care facilities. We required them to say, if somebody is positive for COVID, what do you do with them, right? They can't have a roommate. How do you get them to isolation? Those plans have now been filed. We're making sure that they exist and they're carried out in every place that people live together in our state, the different kinds of facilities that people live together in. Some good news for the brave men and women in our Colorado National Guard. There was an announcement this morning that their service will be extended through mid-August. This is absolutely critical that Colorado's National Guard federal deployment continue through mid-August. Number one, because we need them. Number two, but while we're awaiting confirmation for this announcement, we also know that previously they had been cut off at 89 days, 1 day short of the 90-day threshold for education benefits, for retirement benefits that they have earned through their critical work in this crisis, putting themselves at risk, testing at senior centers, helping with manage logistics around operations. So important. It would have been deeply unfair to our National Guardsmen and women who left their day jobs to do this work, to serve us all, if they had been denied benefits. So while we await the details and the confirmation, it's the right thing to do. And on behalf of Colorado, I'm of course very grateful. We'll continue to receive the help we need during this pandemic from the National Guard. I also want to highlight different good stories when we talk, and I want to highlight a business that's finding creative solutions to help make ends meet. And given that restaurants had their first in-person dining day yesterday, I wanted to highlight an establishment that's been weathering the storm in a creative way. Kathy and Mike Deemer own Johnny B. Good's Diner in Steamboat Springs. And when ski resorts were closed, they knew that business would take a hit. So they transitioned, like many food establishments, to takeout only, utilizing the ice cream counter at the restaurant. But then they went above and beyond, and they started selling groceries as well, which was very helpful to older Coloradans who didn't feel comfortable going to a grocery store. And as we move into the summer months, when some Coloradans are going to the mountains for camping, they're offering to fill your cooler with food and picnic packages from your trip without touching, without interaction. And they've also helped preserve a sense of community at a time when we need it the most. Popular with teenagers, their outdoor seating space in Steamboat has allowed for high schoolers and young adults to be able to be together in small groups in these very difficult times. So with that, I want to read a proclamation honoring the diner as one of the featured businesses as part of our Can Do Colorado campaign. Whereas when the going gets tough in Colorado, we innovate, we overcome, and we find creative ways to safely continue our Colorado way of life. And whereas during this crisis, we're continually faced with the things we can't do, but Coloradans are problem solvers, and in spite of this crisis, communities and businesses across our state have safely found ways to turn can't do into can do. Whereas there are countless examples of this innovative Colorado spirit in action, today the state of Colorado is proud to recognize Johnny B. Good's Diner in Steamboat Springs for their dedication to finding innovative ways to continue serving their community and customers safely during the COVID-19 crisis. Whereas Johnny B. Good's Diner was nominated through the Can Do Colorado campaign by multiple Steamboat residents and visitors as an exemplary business that's acted safely and creatively throughout the COVID crisis. Whereas Johnny B. Good's Diner in Steamboat Springs truly represents the Colorado spirit of innovation, Colorado communities and businesses across our state can look to Johnny B. Good's Diner as a shining example of what it means to keep our community safe and keep our economy moving. Therefore, I, Jared Polis, Governor of the State of Colorado, do hereby proclaim May 28th, 2020 as Johnny B. Good Diner's Day. So thank you. As part of the Can Do program, we're very excited to be able to highlight the success of Colorado businesses. A few questions from the general public before we get to your questions. First one was a response to a post we did on how testing is available. It says, get tested so the fascist governor can use those numbers to shut everything down again. No, the more people get tested, the more we can open things up. It's the opposite of that. One of the lack of testing initially is one of the reasons that there had to be some of these overly broad closures. We have a more targeted approach to this now. When we have testing, we isolate the person who is contagious rather than the whole community or rather than the whole state. So testing is critical. If people aren't getting tested, if they aren't reporting symptoms, it leads to a far worse outbreak with more severe economic consequences and more severe healthcare consequences. Larry said, get tested, find out what you got, then what? Go home and get well like you do with any other virus? You really don't like talking about that fact, it seems. How about the curve? Don't see any information on daily infections or deaths or anything. So Larry, multiple times a day, the information that you seek is posted at covid19.colorado.gov. We have huge amounts of information about the curve, about daily impact. Yes, 9 out of 10 people who get the virus can get better at home. About 1 in 10 need hospitalization. But let's dig a little bit deeper than that. That rate is much higher for people in their 70s and 80s. 1 in 4 roughly need hospitalization, and it's a little bit lower for people in their 30s and 40s. It might be more like 1 in 20 or 1 in 30 that need hospitalization. So we paint with the broad brush about 1 in 10, but it is significantly higher for healthy Coloradans in their 70s and 80s, right? And it is lower for healthy Coloradans in the 30s and 40s, but that is still a big risk. I mean, there's, the normal cold or flu. If I'm 45, I recently had my birthday as well. A cold or flu, I don't have a 1 in 20 or 1 in 30 chance of having to be hospitalized, right? I mean, I've had those my whole life, every year, and I've never been hospitalized for them. And with this one, even somebody who's relatively healthy in my age, 1 in 20, 1 in 25 shot at going to the hospital. And while most make it out, even some my age, of course, don't. So I wanted to highlight that as well. Finally, Joe said at age 75 and highly at risk, I'm happy to see this post about masks. I know that so many younger people are so healthy, they profess knowledge of their immunity to COVID-19 by not wearing masks. I'm also grateful the governor allowed seniors and later everyone to renew their driver's licenses online. Now I wish the state would not force me to take my 1999 car to a crowded e-test station next month. I don't want to spread any of my particles to 2 or more others in the waiting rooms. Online renewal makes a lot of sense. So we're going to look into that. These are great ideas. There's no reason that people should have to go in when they can do it online or simply defer it. We've already allowed and continue to allow seniors to renew their licenses, driver's licenses online. It's particularly important that we're safe. Everything that we can do safely, online, remotely, or simply delay, we want to make sure we do that so those who are able to stay home can do it to the greatest extent that they can in their lives. So with that, I want to thank all of you for joining us and happy to open it up for questions.
Governor,
Yes.
Can you talk about your decision not to extend the executive order regarding prisons and letting inmates who are more vulnerable out? Obviously, the ACLU filed a lawsuit today, but also they've been highly critical of your decision not to renew that. I wonder if that has anything to do with the 2 inmates who were released who actually went on to commit some pretty serious crimes.
Well, we're doing everything in our power to prevent outbreaks in our prisons and protecting, of course, our brave prison guards. But the pandemic is no excuse to let criminals out. And I'm not aware of any basis to release offenders of the ACLU's choosing as somehow an appropriate response to this crisis. So the prison inmates and the guards are wearing masks. In fact, many of the prisoners are involved with making masks, and we're doing everything we can to make sure that we are keeping folks safe. But it's also important for the residents of Colorado to know that, of course, we will vigorously defend against any lawsuit that seeks to turn this pandemic into an effort to release dangerous criminals.
Can you talk about the decision not to renew that executive order? Why did you not extend it?
Well, we are, as I said, we're taking it. We now have testing available in the prisons. We are continuing to do that work. I know there were those who wanted us to commute people because of it. I said no. There's been no commutations. There's been no pardons. I don't expect there to be because of this pandemic. We have a normal process for that. I did do several commutations last December. There are regular, but that in no way is being delayed or accelerated because of the pandemic. We have our normal process in place for commutations and for pardons. Telephone?
Governor, it's David Clue at Denver 7. There seems to still be a lot of confusion over COVID antibody testing. New tests are coming out on the market all the time. Older tests are being pulled. The CDC, still saying they're about 50% accurate overall. What's your advice to people wanting to get them, and what are the benefits of getting them?
So when I give updates on testing here, I'm generally talking about viral testing. Much more rarely do I talk about antibody testing, and if I do, I make it clear that that's what I'm talking about. So when we're talking about get tested, the Pepsi Center, over 36 free community testing sites across the state. You can find a map at covid19.colorado.gov. Those are viral testing sites. That test is the one that I took on video last week. It involves either a nasal swab or saliva sampling. They can do that two ways. And that tells you whether you actively have the virus and are contagious. The antibody test, which is a panel that's run on your blood, determines that you had the virus at some point and developed antibodies to it. You could still be in an active contagious phase, and certainly we advise anybody who tests positive on an antibody test, especially if they're still have symptoms, they should immediately go in for a viral test. But it also could mean you had it a month ago or 2 months ago. So people want to know, and there's ways to get these. Unlike the viral tests, they're not necessarily free, to be clear. We have some antibody tests that are free in certain circumstances, but generally you can go in, and I think maybe it's $50 or something like that. At National Jewish, different folks might charge different amounts. You can get the antibody test. Yes, their accuracy rate continues to be a question mark. And then even more importantly, we don't know exactly what those antibodies mean in terms of your increased resistance to coronavirus. Scientists generally believe that those antibodies confer additional resistance for a period of time. But the two unknown factors are how much additional resistance. Is it like the flu shot where it's 50% increased resistance? Is it like 95% increased resistance? We don't know. And then for how long? Does that resistance last for months or for years? So we certainly, Coloradans acting out of curiosity, can certainly seek out those antibody tests. We have some use cases that we incorporate them into on a larger scale as well, certainly for determining the infection rates that existed in a community and how many people have developed antibodies. But when I'm talking about testing, it's generally about testing for active viral load. Thank you. Next question from the room. Yes.
Governor, yesterday a lot of restaurants in the Denver metro area opened up to 50% capacity. There was not a massive wave of people going to the restaurants. Are you concerned that the businesses may be at risk, or people will be slow in returning to dine-in facilities?
Yeah, it's a tough time for restaurants. It's a tough time for our tourism industry, for recreation. Generally, we're open, but the customers aren't here. There's, if you talk to, depending on where you are in Colorado, often restaurants cater to some customers that come from tourism and other places. We're not seeing them. I mean, I think we've lost 90% of our flights into DIA. So yeah, I expect it'll be some time before our restaurants are full again. I'm glad that they're back and hopefully employing some people. They're still doing a good business in takeout, curbside, delivery. And now they can add into that economic mix that customers, at least some customers, are choosing to return to seating outdoors and indoors. I think the comfort level of customers is more with outdoor dining, just from folks I've heard from. just knowing that it's safer to be further apart. The outside restaurants can sometimes have seats, 8, 10 feet apart. They can be there on a beautiful evening. It not only feels safer, it is frankly safer than indoor dining. We provided guidelines to make indoor dining as reasonably safe as possible, given that we're in the face of a pandemic and individuals make their decisions about whether they're choosing to go out or whether they're continuing to order in or pick up at their favorite restaurants.
When do you think you might be able to increase that to 75%?
Well, as you indicated with the question, it's just not something we're really hearing from restaurants because they're not really filling up the half yet. I mean, I think some of it is a natural evolution. If restaurants are jammed and they're clamoring for more space, we can figure out how they can get more outdoors. Many have the potential to be at 100% capacity or more by having some tables outdoors. And I understand that doesn't work for every restaurant, but many restaurants, through parking lots, sidewalks, their own property, adjacent or non-adjacent private lots, are able to serve at 100% or more capacity today. But the customers haven't returned in droves, and frankly, I think customers will slowly start returning as we have that sense of security, and hopefully these positive trends with regard to the pandemic and the curve in Colorado hopefully continue due to the responsible behavior of Coloradans wearing masks in public and staying 6 feet apart from others where we can.
To limit travel to 10 miles, or what's the status of that?
Yeah, well, Colorado should travel responsibly across our state, and what that means is if you want to go camping, great. If you want to go into some of your favorite mountain communities, that's great. But honor the local decision making. We have communities in Colorado that have chosen to be more welcoming of tourists in limited numbers at this point. We have others that are still actively discouraging out-of-towners from coming by. So these are our fellow Coloradans, our brothers and sisters. Let's not rush anybody. For communities that are willing to receive Denver Metro, Colorado Springs Metro residents, it's perfectly fine to visit those communities. For others that want a little bit more time and have suffered great loss, let's afford them that time before folks might reintroduce infections into their areas. Telephone?
Yes, this is Michael Karlik with the Colorado Springs Gazette and Colorado Politics. And just to follow up briefly on the restaurants, we are hearing from some business owners who say that the capacity limits in place, 50% or 50 customers total, won't be enough to keep those businesses afloat. In addition to the numbers, do you ever think that there will be a consideration of the size of the establishment, the layout of the business, or just the type of restaurant in calculating future capacity limits?
Yeah, I think there's great opportunities to work with county health departments on specific sites and specific restaurants, taking into account their space, their airflow. But I think a lot of these larger restaurants, as well as restaurants that are at the 50%, simply aren't even seeing that many customers. So I have not had any coming to me saying we are full at the 50%, we've got to go to 75. The issue is more, we're open at 50%, we have 10%, we have 20%. We can't get by with only a quarter of our normal customers. So I think it'll happen naturally if there's restaurants that are pushing that limit and have been successful in attracting customers in a safe way. We hope that we can work with county health departments on a site-specific basis to let them serve more customers.
Gobernador, en español,
Sí.
¿qué piensa sobre la demanda que hoy entabló el ACLU contra usted y el Departamento de Prisiones por no proteger a la gente más vulnerable en las cárceles? Y una situación similar que ocurre también con los inmigrantes en las cárceles.
Sí, este es un caso abierto y no puedo comentar mucho al respecto de Procesa, pero es una cosa muy importante que criminales peligrosos no pueden ser libres solamente porque hay una enfermedad en la comunidad. Estamos haciendo cosas para proteger todos los trabajadores y también personas en las prisiones. Todos están llevando tapabocas, por ejemplo. Si un persona tiene enfermedad, él está separado entre los otros y ponerse en un lugar seguro.
This is Lori Jane Gliha from Fox 31. I know you just answered a question like this in Spanish, but to follow up again on the ACLU lawsuit, they're also asking for better identification of medically vulnerable prisoners. And I just wondered, is there any validity to this, what they're asking for, given that there's more than 600 prisoners in correctional facilities who are sick? And how proud are you of the prisons and how they're handling COVID-19?
Well, I'm proud of the prison guards and our director of public corrections. I think they've really stepped up from the early days with masks. And as I indicated in Spanish, isolation plans, meaning when there are inmates that test positive, there is a separation protocol where they can prevent that from spreading to others. We have also, from the very early days, limited inter-prison transfers as well as movement of prisoners between cell blocks within a prison. So we have examples where certain cell blocks are not infected or it was contained to one or two people. In other cell blocks, it got out of control a little bit more. So we're doing our best to prevent cell blocks from being contaminated, protect our prison guards using masks, physical separation where possible, social separation, and of course making increased testing available so that we can successfully isolate those who test positive, including those who are asymptomatic.
Governor Charles Ashby from the Grand Junction Daily Sentinel. I had some interesting numbers from your Department of Labor this morning, and by the way, I want to send kudos to them. They've been great with giving us updates every week for the last 6 weeks. Anyway, so they tell us that about 1,100 people who have filed for unemployment were offered a job back and asked to not be able to go back home or back to work. Of those, 869 cases were reviewed, and only 16% were said you have to go back to work. Now, I've been hearing a lot, and I'm sure you've heard a lot of people saying that workers don't want to go back to work because they're making too much money making unemployment insurance rather than going back to work, and the numbers don't seem to bear that out. And I wondered what you thought about that whole situation.
You know, look, Coloradans are independent and honest, and we want to work for a living. We don't want government handouts. And by and large, when Coloradans have the opportunity to return to make an honest living, of course they want to get off of the government dole and be able to get back to work. I think they're also being very rational in this in two ways. First of all, yes, there are Coloradans, older Coloradans, those with pre-existing health conditions, that should not be at work in a public-facing environment because it is very dangerous. And we want to make every accommodation for them as possible. They can be shifted to a non-public facing position, or they can receive unemployment. But that is very important for them. And then secondly, people understand that this unemployment insurance kick-up is temporary. And so while you may make a little bit more now not working or the same amount, you will also be out of a job in July in an environment with 10 or 15% unemployment. And you might have a very difficult time finding another job. So we treasure our jobs, we treasure our positions, we're responsible people, and by and large, it does not surprise me one bit that most Coloradans are more than ready to get back to work.
Governor, this is Thomas Piper with the Associated Press. I'd like to get back to the ACLU lawsuit. It says that the DOC is not properly cleaning prisons. Wondering if you could respond to that allegation and also elaborate a little more about why you didn't extend part of the executive order that would have allowed for additional releases of inmates. Thanks.
Well, again, as I've said, each time we've had this, it is a pending legal matter, so I can't comment on that'll be determined through the factual basis, but I have great confidence that the team has taken the steps they need to protect the men and women guards in our prison as well as the inmates. I think they've done terrific work in that regard, and it's no surprise that there are some in the advocacy community that want to use the pandemic as an excuse for other reforms, some of which I oppose, some of which I may support. But what we're saying here is we are not willing to use this pandemic as an excuse for unrelated activities.
Your personal story with your mother today. I'm wondering if you feel comfortable going yourself or bring your family to a restaurant or sending your kids to a summer camp now that those are available.
Yeah, so I'm very glad my parents are staying home for the month of June. Certainly, if they were even if they were going out on a limited basis, they shouldn't be going. People in their 70s and 80s shouldn't be going to restaurants and really should be minimizing their activities. They can. It's their choice. But minimizing activities is good. Yeah, in our family, like having families across the state, our son is largely ambivalent about summer camp, and honestly, most of his were canceled anyway. He's not doing any. Our daughter is really excited to see other kids. We found there's a good art camp she likes that has 5 kids or less at different tables doing art, and so she'll be doing that for I think 2 weeks during June, and we're grateful that she'll have that opportunity in a reasonably safe way. But like a lot of families, we have to balance these things. And I'm glad that our daughter will be able to go to summer camp in a way that's reasonably safe. We're not going to push our son to do it because he's ambivalent about going to summer camp anyway. And I'm grateful that my parents are staying in because we really want them to be there for our kids and for us for many years to come.
Governor Derek Draplin here with the Center Square. Last week, you signed an executive order that allocated $275 million in CARES Act funds to local governments, while the state's 5 most populous counties received around $559 million. Over the past week, some commissioners in rural counties have expressed surprise and disappointment at the EO, saying their funding distribution isn't fair. But what's your message to the rural counties that might think that they didn't receive fair funding?
Well, we certainly would are very supportive of as much funding as possible for our local communities. Without the order, they would have gotten zero. So it's really important that we were able to make sure that was not all used for state priorities, but instead prioritize the needs of local communities, of school districts, of community colleges that are all facing unprecedented economic and health challenges from the pandemic. We're also joining our rural commissioners and others in advocacy for more local support in the next federal package, which could be derived from the HEROES package that passed the House or an effort that might start in the Senate. I have cautious optimism that we will be successful working with our rural commissioners in achieving local aid for communities of all sizes, we hope, as part of any federal relief package.
Governor,
we'll do these two. Yeah.
Governor, any idea when you guys might be offering some sort of guidelines to gyms and fitness studios so they can begin to reopen?
So gyms are open for the public in over a dozen Colorado counties already. And in any county in which they're prepared to open, they can certainly file that with their county health department and work with them to get them open as soon as possible, and we encourage them to do that. Gyms statewide in counties that aren't open to the public are open, but they're only open for private instruction and private groups. So as soon as communities are ready, the state looks forward to being a good partner with them and getting gyms open.
And a follow-up to that, are you saying that if a gym in a particular county wants to increase their capacity, they can ask that of their local health department?
We have over a dozen, as of yesterday when I checked, counties in Colorado, including fairly significant counties, that gyms are already open for the public, yes.
Governor, there are hundreds of thousands of Coloradans who can't access...
Well, let me add one more piece on this. So there are also a few counties that have had increasing viral count and where it is still at a level where it is likely too dangerous to open gyms to the public. But even in those counties, gyms can be open for private instruction. But in the vast majority of counties in our state, they can have that discussion with local health about opening gyms, and that's already happened in about a dozen counties.
Governor, there are hundreds of thousands of Coloradans who can't access federal unemployment or stimulus benefits because either they are an undocumented immigrant or simply because they're married to an undocumented immigrant. Is there anything that the state can or should do to help those families, especially because so many work in affected industries?
Well, we value helping all Colorado families. That's a federal program, and while I wish that all Colorado residents were able to participate, there are many Coloradans that for different reasons cannot, and some of those include mixed status families. So in working with local communities and working with our community colleges and working with our school districts, we're certainly helping our institutions that serve all Coloradans, and we welcome any federal aid that helps those who were missed in the first round.
Is there any direct state funding or action for those folks?
Well, this was all federal funding, and so the state doesn't have the ability to do these types of programs, whether it's Paycheck Protection Program, whether it's we're experiencing cuts across our entire state budget. We really appreciated the impact of these federal programs and the families they reached. But if your point is that some families in Colorado were left behind by the federal programs, it's true. That's why we need to work to try to get federal programs that can help meet their needs as well. Telephone, please. What's that? Oh, okay. Last one. Anyone more from the room then?
I wanted to give you another opportunity to answer the restaurant question.
Sure.
As part of that, would you feel comfortable going to a restaurant yourself and bringing your family to one?
Well, they just opened yesterday. We haven't been to a restaurant yet. I've been too busy to think about that. I have supported our local restaurants by taking out and ordering in throughout this crisis. That works well for our family. We're able to support our local restaurants, and we're able to gather around our dinner table in the evening. I think there's some Coloradans that are ready to go out physically to a restaurant, and there's others that aren't. I'm very grateful that my parents will be staying home because I love them and I treasure them, and I want them to be with us for many years to come. I know there's other Coloradans that just want to make sure that we have the very best potential security measures in place around distancing and masks, and that they're willing to return to that part of their life. So, haven't made any decisions on that. Our daughter's in a small day camp. Our son is not. Our parents are staying home. And we'll see whether the first time we go out is in June or in July. I'm confident that at some point we'll look forward to taking the family out to a restaurant with the kids.
And one last question, Governor. Your mother mentioned that your son sings to her on Facebook. Would your office consider sharing a clip of that with us to use in some of our reporting? Is that something you would
Probably not. We try to we limit the images of the kids. Maybe the voice we could do. I don't know. But yeah, we could do the voice. We could do the voice, or maybe from the back of his head or something like that. We could do. He plays the piano to her too, so we could do that. COVID-19 relief fund update: over $18 million raised. Encourage everybody to go to helpcoloradonow.org. It's a combination of contributions from individuals like yourself, from corporations, from the philanthropic community. They're in their fourth round of grants, getting out to the Coloradans that need it the most. I want to thank Colorado for stepping up, for wearing masks, for being 6 feet apart from others where you can, and from really helping us all to get through this in as strong a way as possible. Thank you.